Hello, Rob and Austin here to solve doctors' 3D problems. And today we're going to talk about all-on-X cases and the annoying reality that sometimes you have to make occlusal adjustments to zirconia all-on-X cases. And although it's considered by many as sort of just that final fit and finish step, adjusting zirconia is difficult and it brings compromise. And wouldn't it be nice to eliminate that problem? So Austin is here today to talk about the root cause of misalignment of jaw scans and how we can have a predictable workflow for virtually zero adjustment all-on-X zirconia cases. So Austin, thanks for being here. Let's talk a little bit about the problem of jaw relation scans and how sometimes there's some minor discrepancies that you have to sort out in your process to get to that perfect result.
That's right. So our topic is jaw relation, and the problem at hand is that the occlusion is off. That's what we usually hear as the technician or the designer. What we've come up with is a process to eliminate the necessity for occlusal adjustments in the final. And that's what I'm here to talk to you about. So usually as the lab technician, we're going to hear the arches are hitting high on one side or in a particular area. And can we adjust the design to accommodate that? At our practice, Bullard Dental, we've come up with a process to correct this jaw relation. So we deliver an immediate temporary in PMMA. That PMMA may need occlusal adjustments. And then we've come up with a process, steps to align various scans to correct that jaw relation. And on our final prosthetics, we do zero adjustments on the zirconia. And so that's what I'd like all of our full arch friends in this industry to have this nailed down. So I want to show a particular case here. And I'm going to share my screen. So I want to show you guys a case here where the patient came in with natural dentition, compromised. We did surgery, and then we made adjustments to the occlusion. And the correction that we made is not physically to the design's occlusion, but more or less to the relationship of the upper implants to the lower implants. So let me switch over here to my screen, and I'll show you this patient. So here is how we started in pre-surgery. We have an upper and a lower arch, and we're going to be doing a dual case, so an upper and a lower design fixed as well. When we refer to the upper or the maxillary arch, what we're doing to keep this position pre and post surgery is we're adding what we call they're called tenting screws. So they're made by Salvin, but we place 3 tenting screws in the palate before we do any extractions. And then we are using those tenting screws to align the pre-surgery scan into the into the final tissue scan.
So you're referencing tenting screws, which would be fiduciary markers, is a term
Correct.
I've heard a lot.
Yep, that's right. Yep, these are fiduciary markers. Basically, they're placed into the palatal bone, and then they stay there. So any scan that includes those screws can easily be stacked on top of each other. Then we use the photogrammetry scan to get the upper implant position. When we're talking about the lower arch, this is more commonly the difficult arch to keep the jaw relation. I've seen fiduciary markers placed along the heels of the posterior sections of the lower. We did that in the beginning, but what we're doing now is called a mid-surgery scan. So we're selectively extracting teeth, and we're selectively placing implants. So on this case, we were able to place 4 implants and then take a scan, leaving some natural dentition. What that does is it lets us then align these 4 implants, or the scan of the scan bodies. Those are our Bullard alignment healers. So these are our scan body. It's called the Bullard alignment healer. They fit directly onto the multi-unit. Once we take this mid-surgery scan, we're using those 4 implant positions and the data from photogrammetry to gain the remaining implant positions. And then what we can do is align the soft tissue to those implant positions. We find this to be a more predictable and repeatable alignment step. Like I had mentioned before, I do all of the initial design, the aesthetics, the tooth placement on the pre-surgery scans. So I'd like to keep this design from beginning to end and not have to adjust my occlusion. When we talk about adjusting the jaw relation, what we're doing is we're stacking a series of scans and correcting the position of the lower photogrammetry. So I'm going to slide in our corrected Bullard alignment healers, and you'll see they're just slightly different, a little higher on the right than on the left. So as we pull in this new set of...
Zoom in, and I'd love to see this discrepancy. And when you slide from the left to the right, what are we looking at here? Which scan are we looking at?
So this is really zoomed in on the lower right-hand side, and this is the 2 series of photogrammetry. So this is the one from surgery day, and then this is the one that we've corrected the jaw relation in. You can see it's... Go ahead.
Discrepancy there of how much space would you say that is? Like a half a millimeter or what?
Let's take a measure. So I have a discrepancy here of a half of a millimeter, 0.4 on the right-hand side, and then let's check it again on the left.
Okay, let me find it. It was a party.
On the left-hand side, we are 0.375, so a little higher on the right than the left, but we're talking microns here. And so when we go to update our design, instead of making adjustments to the teeth or how the teeth occlude with each other, we've just changed the position of the lower implants, and we'll readapt our wax up, this lower wax up, to the new position of those scans. And what that does is it eliminates any design time for me when I'm going to update this patient's design. Now, if they want to change tooth size or change tooth position, we can do that, but that's totally separate from jaw relation.
So you have this perfectly designed arch that's perfectly interdigitated with the function that you want, the disclusion that you want, and instead of correcting that beautiful occlusion, you're just readapting the way it's fitting to the implants. But we're talking a readaptation of like 0.3 millimeters here, so that we can achieve this zero adjustment, perfect occlusion zirconia case.
That is exactly right. And with today's market moving to titanium substructures and zirconia superstructures, the design and the manufacturing of those things is been perfected. Now we have to perfect the records in surgery.
Amazing. So anything else to highlight here in this workflow in achieving this zero adjustment case?
Yes, I'm here as a resource for the industry. So if you guys are having this trouble, please reach out to me. We have different steps of correcting jaw relation or maintaining jaw relation depending on the patient's natural or existing dentition. So if they have natural stable dentition or they come in with, let's say, no dentition and existing dentures, there's a couple of different scenarios that patients can come in with, and we've come up with a workflow for all of them.
And Austin, you've had many years of experience as a technician, and then recently as a chairside clinical technician. How many years have you been doing all-on-X cases, going chairside with record taking, and then also design and manufacturing?
I've been chairside involved in every aspect for 2 years. And
amazing.
Prior to being chairside, I was doing full arch for about 8 years before.
All right, so 10 years in full arch, 2 years in chairside. What an amazing resource. If any of you guys want to reach out to Austin, he's available as one of our Rebel agents. You can go to rebel3d.com/Austin, and you can book time with him, interact with him, and he is here to help you create beautiful, perfect, no adjustment zirconia occlusion that drops in with that ideal occlusion that you designed.
That's exactly right. And I want to say thank you, Rob. What you're doing is great. This is needed in the industry, and I can't wait to see where this in Rebel 3D goes.
Awesome. Austin, thanks for being with us, and look forward to some more 3D problem solving with you in the world of full arch and maybe some other things.